Shifting our focus to a very tragic story of a young girl who lost her life to cardiac arrest. In fact, the visual is shocking. And very sadly, it happened during her farewell speech. 20-year-old Varsha Karat, a bright college student, was addressing her peers in Marathi, sharing a light-hearted moment on stage. Mid-sentence, her voice falters. She slows down and suddenly collapses right in front of a packed auditorium. Panic sets in, people rush to her. She was immediately taken to a nearby hospital but was too late. Doctors have declared her dead. Now, this tragic incident has taken place at Maharshi Guruvarya R.G. Shinde Mahavidyalaya in Paranda Taluka of Maharashtra. Heartbreaking visual here showing Varsha there falling to the ground owing to a cardiac arrest. Now, Varsha is not alone. Remember, teenagers, young professionals, increasingly in India, are suffering heart attacks. This isn't just an India problem also, it's a global phenomenon, it appears. So the question, of course, that we raise here is what's triggering heart ailments in such young people? Why are so many lives being cut short just as they begin? More importantly, can we prevent this? Joining me for a little more insight on this, Dr. Sanjay Kumar, Director and HOD Cardiology of Fortis Escorts Hospital. Thank you very much, sir. I'd like to ask you a straight question on whether young people in India, teenagers or people in their 20s, must get their heart health checked. Earlier, we wouldn't even think of something like this until late 30s, 40s. But increasingly, young people are dying of heart attacks. What do you think is the reason?
Ma'am, first, we should be clear what is a heart attack and what is a cardiac arrest.
Right.
The lady seen in this video appears to have had a cardiac arrest. Now, cardiac arrest is something in which the heart either becomes too slow or beats so fast that it is not able to pump blood adequately to the vital organs of the body, that is, most importantly, the brain. So you fall down and unconscious. Now, heart attack is is the most common factor causing cardiac arrest, but not the only factor. And if you look at the age-wise categorization of what are the causes of cardiac arrest, at least at 20 in a young female, definitely heart attack is not the cause. Please remember, women, because of their hormones, are protected to a great extent, to some extent or a great extent compared to men till the age of 50, 55 years, till their menopause, by their female hormones. So very unlikely that this lady had a heart attack. But yes, she had a cardiac arrest. There are other causes also of cardiac arrest. Some diseases of the cardiac muscles, which are called cardiomyopathies. There's one RV dysplasias and some rarer causes, channelopathies, which now, because the healthcare is penetrating, we are able to diagnose things. Ma'am, most of these cases, it petrifies us also. How is someone falling? Probably someone who's trained in basic CPR could have revived her. That is the most important thing. People around in that convocation, if someone was basically trained for CPR, she would have survived it. And the other thing that I want to say that most of these cases, no postmortem is done. So we actually really don't come to know what was the exact cause. There can be many causes in the younger age group. There is awareness to fitness now because of heart issues being told everywhere. There is awareness for fitness. We are probably overdoing it. Most going to gyms and all. I'm not saying in this case going to gyms and all, taking proteins, taking synthetic drugs for bodybuilding. These are also probably adding on to such events. And the other thing, which I have no verified thing, this thing, but I strongly suspect is the prevalence of synthetic drugs in our schools and colleges that is penetrating a lot. So there can be many causes.
Synthetic drugs in our schools? Is that what you said? What kind?
The synthetic drugs that are getting into our society a lot, and the younger naturally get attracted to it. This is my personal opinion.
Drug abuse,
but I told
you
you there are many more causes.
Right. Right. Doctor, thank you very much. I appreciate your time for joining us and sharing your thoughts on that.